Good evening. My name is Megan Deese. I'm a student at Jacksonville State University. I'm going to just discuss my project with you guys. The title of my project is Emergency Department Staff and the Critical Need for Emergency Preparedness and Response. Listed here, you'll see different photos of natural disasters that are occurring and the response to those. My population of interest is emergency department staff. The emergency department staff is comprised of nurses, physicians, clerical staff, respiratory therapists, patient care technicians, radiological technicians, other hospital officials, EMTs, anybody that's currently employed as working in the emergency department. Research indicates that more Americans than ever are using emergency departments for medical care. Emergency departments provide care for the uninsured, the insured. They're open 24/7, nights, weekends, when everyone else is closed. They provide a broad spectrum of care. The staff are required to be proficient in multiple areas of expertise because there's no prediction on what kind of patients will be encountered and cared for that day. ED utilization has outpaced the growth of the population in the past decade. There's approximately 136.3 million ED visits in the United States annually. Let me repeat that. 136.3 million ED visits in the United States annually. That is an insane amount of individuals seeking the emergency department for care. Also, that tells you how many people could be in the emergency department that aren't even staff during the emergency. So staff's also going to be responsible for these people as well. Our biggest issue of concern impacting emergency department staff is related to disaster preparedness. A disaster is defined as a sudden event bringing great damage, loss, or destruction. When, not if, a disaster strikes, it will be considered an emergency and it will be the responsibility of the emergency department staff to provide care to these patients. They will be sick, injured, and affected, and even looking for loved ones who were involved, and those individuals will also be directed to the emergency department. Disasters cause harm anywhere from 1 to hundreds or even thousands of individuals at a single moment. They can affect entire communities at a single time, and the healthcare system plays a very important role following disasters. A disaster obviously brings forth chaos and panic that can accompany the injuries caused by these disasters. The staff in these emergency departments will be the frontline responders during and following these disasters. There is a lack of disaster planning and preparedness amongst ED staff. Studies suggest that nurses are not ready to experience mass casualties, but their training, education, and workshops can help to improve confidence and competency amongst ED staff. Here you see the Healthy People 2020. For my initiative here, I believe that the preparedness category is the most applicable to my project, and that goal is to strengthen and sustain communities' ability to prevent, protect against, mitigate the effects of, respond to, and recover from incidents with negative health effects. Obviously, disasters fall into the category of this. The 5 sub-roles of the advanced practice nurse, as you can see here, I've got research, clinician, consultant, educator, and administrator. We'll dig deeper into those in just a moment. Interventions. These are the interventions that will coordinate to each one. So if an advanced practice nurse under the research category, this would include conducting community assessment of knowledge of disaster preparedness and response, with the intervention strategy being distributing surveys to the community, performing questionnaires at the local community meetings just to gauge on the level of knowledge there. The second would be the clinician. Identify specific needs of ED staff related to disaster preparedness. You would do this by going to local emergency departments and assessing the protocols in place, directly asking the ED staff about available plans and resources, and requesting ways to better educate and engage the staff on disaster preparedness. The third one we have would be under the consultant. That would be planning and gathering data on what needs to be mandatory by all ED staff. That strategy there would be research emergency departments that pride themselves on ED preparedness, analyze their actions, and take that education forward and spread that to other emergency departments. Number 5, we have the administrator. Evaluating core stakeholders' resources to achieve health goals, including health promotion and disease prevention activities. This strategy would be discover available resources available in that community that could be utilized, applying for grants to obtain adequate supplies, and discuss different training capabilities. The literature review here, I founded 3 different articles and just dissected them for our literature review. You can see there which level each one fell in and the brief description of those. Environmental, individual, and agent factors. Emergency preparedness being utilized in the emergency department is a team effort. Obviously, disaster mass casualty event will most likely occur outside the hospital, and then the patients and individuals will be brought in. Whether tornado or chemical exposure, victims will present to the emergency department. It is the responsibility of the ED staff to be ready for any and all event, and depending on the specific agent that could have caused the disaster, we'll decide specifics on how to manage the victims. When you start talking about agents, decontamination, all those things are included in this disaster response. The 3 scholarly articles goes back to the evidence there. That just once again, if you do the look ahead to the slide before and go over the literature review there. The summary of rapid appraisal checklist. This shows the 3 different articles. One was, let's see, we had an ethical analysis. We had a survey of emergency department chemical hazard preparedness, a 7-year comparison from Michigan. That's an article and a study that they've been working on for 7 years now. And then a different article, it was a certain gas irritant syndrome agent that they were discussing signs and symptoms of, and then trying to apply a triage algorithm. Primary, secondary, tertiary prevention efforts. Primary prevention, I like to think of P for prevention. That would include vaccines. Secondary prevention, S for screening and education. And tertiary prevention, I think of T for treatment of disease. Population of interest is emergency department staff pertaining to the issue of lack of emergency disaster preparedness and response. Since this is not a patient population, the primary, secondary, and tertiary levels of prevention do not exist. However, the topic of emergency preparedness is based on preventing chaos from ensuing following a disaster. Education is the sole focus of this, and that would be directed towards emergency department staff and would most likely fall under secondary prevention. The most effective interventions within the sub-roles, discussed this earlier whenever we were talking about the 5 sub-roles of the APN. Nursing theorists, Jean Piaget. You see him here. The constructivist theory, it can be divided up into 2 important frameworks, learning by teaching and cooperative learning. This theory can be applied anytime education is desired. Each one of the interventions listed above could be implemented using the constructivist theory. The goal of each intervention is to obtain knowledge through different research methods, developing exercises to train staff, and collaborating with peers. Patricia Benner has the from novice to expert theory. The individual transformed from having no experience in the field to becoming knowledgeable in skill and application. She believes the highest performing nurses develop their skills over time. I believe this to be true. We don't require brand new nurses out of nursing school to have the same knowledge. We hope that they would not have the same knowledge as someone who's been working as an emergency department nurse for some years. So she says that there's 5 steps of clinical competence, and it goes from novice, beginner, competent, proficient, and then to expert. The summary of the needs assessment here. This is based off the CDC needs assessment tool. The results basically come down to there is a definite need for additional education. Priority education plan. There's a priority for emergency department staff would be educating pertaining to emergency disaster preparedness and response. There's a trend across the United States that emergency department staff does not feel prepared and or does not receive proper training to disaster preparedness and response. Proposed education plan. Those would include different things such as FEMA online resources. Those are free. lectures, tabletop exercises, mock scenarios, and collaboration. We would provide a handout to the staff members. The image below is more specifically to first responders and ER staff. It's the START triage method. It's just a different, you would use disaster tags, and each patient seeking treatment would be applied a colored tag based on their level to be seen. So this would be a handout that we would educate emergency department staff to use efficiently. Geographical location of the population of interest, I focused on Hoover. There's just some different statistics about Hoover. It's located in the central part of the state. Trends and events. This is different things that have happened around the community. Hoover's in a good area around multiple healthcare facilities, and they can tend to seek treatment in multiple directions of their city. Local government structure, pretty typical: mayor, city council, and city administrator, and then various boards and committees. Key leaders, there's a mayor, council, and then different chiefs. U.S. Congress representation: Senior Senator Richard Shelby is a Republican. Junior Senator Doug Jones is Democrat. State representation is Gary Palmer, Republican. Health policies, these are the different health policies that would apply. Code of Ethics, Provision 6, the nurse, their individual and collective effort, establishes, maintains, and improves the ethical environment of the work setting and conditions of employment that are conducive to safe, quality health care. Health policy advocacy here. Different organizations, statewide, nationwide, that are in support of this. Demographic and social economic characteristic. One thing to note important here is that the population of 84,100, majority are white, 94.9 are U.S. citizens. I thought it was very interesting that the median household income is $78,507. There's growth there from 2015, and it is one of the highest in the state. Vital and health statistics, you can see different things here. Opioid use on the rise there, unfortunately. Nationwide opioid epidemic. Summary of the windshield survey. Most all signs presented in English. These are both pictures from the community. Current houses in construction. Let's talk to a couple leaders in the community. I spoke with Miss Byrne, principal at a local elementary school. Also spoke with Mr. Smitherman. He is a charge nurse at the Midwest Emergency Department, and he's a Hoover firefighter. 3, priority community diagnosis. Overutilization of the emergency department. I think this is a nationwide thing happening here. Violence in the ER and lack of preparedness in the community and emergency departments. This is our community diagnosis. Most important would be that lack of preparedness. A couple different cartoons here. Best interventions to present an evidence-based educational plan to the staff in the emergency departments to improve disaster preparedness and response relating to mass casualty events. Measurable plan objectives. We want to develop an educational pamphlet to hand out, compare different protocols across the state, and get all the staff members there. We want full attendance to these educational seminars. Our detailed plan, distribute those surveys, make sure they have the knowledge, make sure they know about available resources. Potential resources in the community, there's lots around this area. A couple challenges would be staff members not attending, not enough funds to purchase materials, hospital administration not offering to pay to attend the class. Team members must be present. Key stakeholders in the community, and then just references here. Thanks so much for listening to my presentation, and I hope you enjoyed it. Thank you.